Kozhikode. I would like to welcome today's resource person and the coordinators and founders and all the participants. On behalf of the organizers, Manasa Sukkara Mind Care Center, Hyderabad, and Yellow Pond Counseling Center, Hyderabad, and Forest Creative Art Studio, Punjab. And like to give the introduction about today's resource person, Dr. Sripriya. She done doctorate in counseling psychology. She is also a nutritionist and an art therapist. She has the experience of working along with the eminent doctors for over 2 decades in multi-specialty hospitals in Chennai as well as in Kozhikode. Her scientific publications have figured in 12 international and national journals. She also has 14 scientific presentations to her for credit. She is the founder of Srisha Counselling Kozhikode, which is affiliated to World Mental Health Federation. She works with individuals, groups, and organizations to amplify their authenticity and empower them to become a better version of themselves. She also founded Women Mental Health India, a special wing for women-related issues. Co-founded Community Nutrition Forum Kerala. This community of nutritionists working towards health awareness and right eating habits among general public. She is also presiding Emotional and Wellness Council, WICCI Kerala. Also a renowned speaker, and her signature topics are women empowerment through nutritional psychology, wellness and self-care, managing anxiety and stress, prioritizing mental health through good nutrition and healthy periods. This kind notes, I like to hand out session to today's resource person. Ma'am, over to you. Floor is yours.
Thank you, sir. Thank you so much for your kind words, and I really thank you for giving me the opportunity to be the speaker for the day. And I had fully congratulate your 25th series, sir. Okay. So shall we move on to the session? Can I share my screen?
Yes, ma'am.
Can you all see this?
Yes, ma'am.
Okay. Thank you. Okay. Today we are going to talk about the nutritional psychology. Most commonly, not everyone is aware of this subject. This is basically understanding between the basics of food and mental health. Okay. So before entering the topic, as sir had mentioned, I'm a nutritionist. My undergraduation is in nutrition and dietetics, and my post-graduation is in psychology and psychiatry. Before entering the session, I would like to give you a small introduction about that. But before that, hope you all had your coffee. Yes?
Yes, ma'am.
Okay.
Yes, ma'am.
So how many of you like coffee or don't like coffee? If you like coffee or if you like any beverages, what is that specific beverage to you? Is it an energizer, an emotion, a mate, or an addiction? Just keep this in your mind. We'll move on to the session. And as an introduction, I thought why I have had a more interest towards nutritional psychology. I thought I must say this. Being a dietitian, I was working in a multi-specialty hospital in Chennai. I was coming across so many patients, and every time I come across a patient, and I'll say that please don't eat this, and you don't eat that. Every patient will ask me, "Can I eat a little? Can I eat a little?" So this is the first question. Why is that people are so much, especially when we come across anthrites, they will ask a little amount of pickle, and if it is a Keralite, not even a bit of coconut, or a Tamilian, they will ask without salt or pickle, puppet, and this kind of some culture and some common thing they were all having in their mind. And as we have said, coffee. We are just thinking how many coffees we are having in a day. Can we skip at least one coffee in a day? I have come across n number of people saying that, hey, without morning or evening coffee, I'll get headache. Are you coming across such people? If yes, this is a real interesting session. And before that, most of us must have been back from work just by now. If you want to have your coffee, you can have your coffee. But along that, I want to present a case. It is about one of my first initial cases during my post graduation in psychology. When I was a researcher during that period, I had come across this boy Raman. That time he was 11 years old and he was referred by a teacher. The reason for reference is his academic skills are very bad. He couldn't write according to his age or read according to his age, and he messes the classroom. He cannot sit for more than 20 minutes, and he's just being a gang leader, like continuously bullying somebody or stealing people's food, lunch boxes, and disturbing classes with the throwing the rackets and other things. So this kid, when we examine, we will start taking history, right? Then I understood he is the first of three children, but the mother had immediate next pregnancy, so he was left with the grandparents, and he was feeling it very difficult to cope up with the larger generation gap because the grandfather was a militant and he want a very disciplined lifestyle, and he belongs to the senior years, and this child is totally hyperactive and he couldn't listen to any of his grandparents words, and grandmother was very pampering, very like pampering everything over food, and she was so emotional, like she cries, she keeps pampering the child for everything he wants. So the child was so adamant, and he was totally disproportionate for his age. His height was 125 and weight was around 110, which is very high, and his abdominal girth was around 34. For children, it must be less than, especially for 11 to 15 years old, it must be less than 30, but he was around 34. And he was really short, stout, and stunted. And basically, while he speaks like very arrogant and very timid, but basically this child is very inferior and he fears even with the shout. And when his biochemical parameters were examined, his iron level was just 9, which is supposed to be 12, and calcium was 8, and vitamin D was 2 in deficient, which is only 5.6, which is supposed to be 30 to 100, right? So this is the case. We'll just keep this case here and let's move on to the session. What is nutritional psychology? How many of us come across this term while studying? Not most of us, right? Because this is an emerging field in modern medicine. However, most of Indians, especially Dravidians, we must be heard of two types of medicines, Ayurveda and Siddha, which often uses food for every type of treatment, and food is the first line of treatment. So, where in Dravidian culture, we have always come across the saying that food is everything, right? Food is everything. Food is the medicine. So, this same thing is what is there in Ayurveda principle. They call Aham Annam. You are what you eat. And this is what today modern medicine is evolving into nutritional psychiatry. Nutritional psychiatry is already in practice, and in which they use food and food supplements as the alternative or first line of treatment. Other kind of medical fields like diabetes or even endocrinology has already accepted food as the first line of treatment, and nutritional psychiatry is also accepting food as the first line of treatment. And when psychiatry is, we all know that minor differences between psychiatry and neurosciences. So in nutritional neurosciences, they are considering food as an intertwining factor between cognition, behavior, and emotions. So neurosciences are not much different or deviated from psychology, which is along with the social skills. We in nutritional psychology are studying to find the relationship between dietary intake with the different aspects of psychological health. This field of nutritional psychology is in, to examine the interrelationship between the diet on mental health. So this is what going to be our topic today. I'm not going to much touch your psychiatry or neuroscience, but I'll give you a hint over this. First, when we talk about nutritional psychiatry, this is completely on the biological things. So, when the biological factors intervenes, they call it the CNS and enteric nervous system is bidirectionally linked. Enteric nervous system is our gut functions. CNS, cerebral nervous system, is central nervous system, is our brain functions. So they say that both are interlinked and intertwined. It is always that endocrine system or our gut system, continuously these microbiomes have a very important role in our mental health. I can give you a small or simple example. How do you feel with your irritable bowel, or if you are having a platters while you are into the important meetings? This is not just your psychosocial reflex, it is also the brain getting affected and your central nervous system get not accepting with this kind of things. It may or have the inflammatory hypothesis, which is involuntarily shown as depression, anxiety, or neurological stimulus like autistic spectrum disorders, schizophrenia, neurodegenerative like PD and ALS. So, in this gut, they call it as a second brain. So, in this, what is this?
Excuse me, ma'am. Slides are not moving.
Which slide it is there, ma'am?
First one.
Sure. Can you see the slides now?
Yeah. Gut brain axis.
Okay. Can you see this?
Yes. Case study over a cup of coffee.
Okay. This have you already seen this slide?
Yeah. Till now, only first slide, ma'am. Nutrition psychology.
I'll try once again to give a full screen view. Can you see this?
Yes, ma'am.
Okay. If anybody wants to just have a quick brush, you can look into the slide. Can you see this?
Yes, ma'am.
Submission?
It's visible. You please go ahead.
Now I'm in the gut, the second brain. Can you see that?
Namaste. Hope everyone had a coffee. That slide.
Then I think I can move with this only.
You can go with your flow, ma'am.
Achha, fine.
Yeah.
This like instead of making a full view, can I have like this? Is it okay for you all?
Yes, ma'am. We are on definitions. Thank
Achha.
you.
Okay. So when in psychological aspects, the gut second brain, I can easily or simply explain this with the famous songs like whenever there is a romantic song, they all say that you'll have a butterfly effect in our stomach, right? Have you all come across such songs? Hindi, Tamil, Telugu?
Yes, ma'am.
So
Yes, ma'am.
this is what is the relationship between the gut and the brain is can be simply given as when we are going to our exams or you are into a love affair or into a fear state or attending an interview, we have a mixed feeling of eagerness, fear, and aversion all together, right? Sometimes when we are attending the interview, we'll feel like how will be the interview. We have lot of imaginations, right? So this kind of perceptions will start from our stomach, and this kind of anxious or emotional feelings is reflected as our mental makeup or our personality. Sometimes it reflects on our personality. This is what we are going to see in detail as a nutritional psychology. So, in nutritional psychology, what the study or scientists are trying to analyze in the present day is we are focused on diet mental health relationship DMHR with the following 6 elements: psychological aspects, psychosocial, behavioral, cognitive, interceptive, and perceptual. What are they? I can explain that. very simple psychological aspects or emotional, what you feel like. For example, after a strong episode of any problematic situations, how far you can able to get back to your resilience mode, or your creativity, or your happiness, depression, anxiety, irritation, sadness, all this comes under psychological method of or way of eating. We are seeing so many people, they eat a lot when they are sad, isn't? And some say that when I'm sad, I cannot even think of eating. Some, like whenever they are feeling anxious, they will go for a particular food. They will say that no, I cannot eat too many foodstuffs at this moment. I can only eat curd, or I can only eat a limited amount of non-spicy food. This is all the psychological dietary habits. And psychosocial, this is easily I can explain with this map. Can you all see the map, breakfast map of India?
Yes, ma'am.
Yes, ma'am.
Okay. This psychosocial is mostly our eating pattern is not decided by us, but it is decided by the family, culture, community, society. Like when you reside in a particular society, you go for a particular staple and you continuously eat that, and that becomes our staple, or that becomes the food we like the most. This is the psychosocial impact on our nutrition. And the behavioral, this is very very important, because this behavioral aspects are very much dealing with the future problems. The behavioral aspects, like some love to eat munching during watching the movies or during their work, especially during the work from home situation. We come across so many people saying that they keep on munching or binging some foodstuffs. Particularly, they go for a salted pickles or salted chips kind of things. This behavioral eating pattern is very engaging, and this dietary intake is very high, and this particularly have lot of impact on the psychological, that is the mood and resilience factors, or mood and the emotional factors, right? And cognitive, this is the very important area of research in neurosciences, how the pregnant women or a mother eats, and what is the impact of this food on the child since the fetus stage to the growing stage. So the eating habits of the mother or the pregnant women is having a lot of impact on the child, and post birth the child's eating habits up to 2 years and further is one of the important thing behind their neurodevelopmental stages, their cognition, attention, memory, learning, and reasoning. This even studies has revealed and said that the children who skip their breakfast continuously for over a 2 or 3 years of period, they will have poor memory, and they will have a poor executive functioning and decision making skills in their teenage or further years of life. And again, the children who eat very high fat and high salt and sugar foods, they will have no attention or less attention, and they behave hyperactive also, and their life skills will be very less. They cannot get back to resilience, or when there is a problem, their conflict management is very poor. And studies have widened in this area of cognitive functions, and even autistic spectrum and ADHD children, the studies have said that food has larger impact in controlling their spectrum, or reducing, or even further diminishing their spectrum. So the children with complex foods or comfort foods, even the parents, because this autistic spectrum or ADHD cases, the children will be very fussy and particular about their food, like what they call the symmetric habits in their behavior. The same will be reciprocated in their food habits to eating behavior too. So in these areas, when the children are having, because they have a very particular food habit, their nutrition is already deficit. When they are altered with the proper nutritional habits, their biological and neuro behaviors get diminished, and they get better with the proper eating habits. What is this interoceptive? This is very important for our psychological neuropsychology practice. This interoceptive habits are a kind of, I can simply say it is a kind of a sense what you feel like I want to eat this now at this moment. Some we come across people saying that I just need a dark chocolate now, or I just need a cup of coffee now, or I just need this particular food immediately. And especially this is very high in women, and especially during their premenstrual phases we come across this interoceptive eating behaviors. This is internal bodily signal and sensation towards a particular food or towards particular cravings. I can simply say particular cravings. One among this is a common eating disorder we are coming across is taika eating habits. That is eating mud, rocks, slate pencils, that is lime salts. All these things comes under interoceptive eating behaviors. What is this perceptive nutritional psychology? This perceptive element is nothing but the relationship between your dietary intake with the famous sight smell. Because according to, as I earlier said, psychosocial, according to our particular area of growth, we come across particular foods. For example, in our childhood we have a very strong sensation towards this son papdi wala. They just ring the bell, ding 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 ding. The sound will stimulate us to run behind them, and the flavor of biryani, or the flavor of some of our favorite foods, or even the flavor of coffee, and some foods which we just pass by, the street foods like pani puri, samosa, pav bhaji. All these things are perceptive eating behaviors, right? These are the 6 elements which is very much psychologically shifting our eating patterns and our eating behaviors, which in turn having more impact on our psychology and our emotions, functions, and our behavior styles, habits. So earlier I asked you all a small question. What is coffee to you? Can somebody, few of you, answer this question? What is coffee for you? Excuse me. Can few of you give a small answer? What is coffee for you? How many of you drink coffee when you feel alone? How many of you can you all hear me? Hello?
Yes, yes,
Yes.
ma'am, audible.
Yeah. How many of you feel that I cannot survive without even a single coffee? Is there someone like that?
We will get energy, ma'am.
Okay. But we are coming across so many people. Generally, people will say that, uh, for example, when we get some appreciation or when we get some promotions, people will say, let's party immediately. This kind of food is seen as emotions for some, and for some
Yeah, in
people,
chat box from Binita Sarkar to cheer us, from Anita ma'am, energy, then Bama Devi, addiction of caffeine.
right.
From Archana Vedantam, she replied, my auntie. Yeah,
Okay.
ma'am.
Okay. So likewise, for every single person, the coffee has a different impact. Even there is a famous movie in which the coffee is, I think Coffee Dandagam. There is a song called Coffee Dandagam. So like this, there are people living in along with us in our society. It may be your parents, your uncle, aunties. If you ask them, they'll say, no, 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 I cannot skip my coffee. There are people who says that I want my mornings only with coffee, and there are some particular food they are very much emotive to. So how people see this food in their life as not just food is a fuel for us. Most commonly, the relationship food and emotions starts with the first very breast milk. first very feed, the child touches the mother, it feels a safe and security in the hands of mother. Once it starts feeding, that is the first emotion, the child gets safety and it stops crying to the outside world and it starts taking its feed. So for some people, food is still power and it is pressure. Sometimes we were like, not just alcohol or smoking happens with the pressure. Sometimes even when we go to workplace, we'll say, no, no, I don't eat. Like, I don't like this. But the peers will say, what, you don't eat this? How come, yeah? This kind of pressure happens with food. And for the purpose of our love and our enjoyment, we start eating certain foods. And some emotionally, they find solution to all their problems with certain foods. Or sometimes we think, okay, let me move on with my food so that I forget the particular issue or problem, the way of escapism. And for some, it is just a business. They just keep selling food for their own marketing, and some it is a status symbol. Hey, how come I bring a normal salad? It is not very quite appreciable for me. It should be a hi-fi salad. It should be a paneer salad or something very high. So this kind of status-wise and democracy, and for some, food is the way of expressing their vengeance. Some eat just because they want to control their vengeance. So food is not just food. Food is an emotion, and food is also our way of escapism. So what happens when we eat for all these reasons? We lack mindfulness and we go mindlessly affected to food. This is the basic understanding with food and our mental psychology. So, who is mostly affected with this wrong or psychological food habits is all ages. We will get affected if we have this eating habits towards wrong emotional state. And for whom it is very crucial, it is for pregnant women and children, because it also affects the cognitive functions of both the child and mother. So it is very seriously, even in old age, it affects our cognitive function and increases. Even if you are continuously in a wrong food habit, your cognitive decline is uh, quickened. So it is always affecting all ages, but the maximum effect is seen in pregnant women and children. So, what is the impact of food or nutrition, healthy food habits in mental health? Is in mental health, it increases the emotional quotient. It sharpens the thinking mind. It increases the, I think the slide is vice versa. For mental health, it sharpens the mind, the thinking ability, and increases the concentration, improves the performance, and reduces stress. For the emotional factors, for example, like creative thinking, better decision making, managing your mood fluctuation, quietness, calmness, contempt feeling, all these are improved with the better nutrition. Overall, it brings a positive social and ethical impact. So, why this mental health is badly affected, and what all the very most common cases we come across with the nutritional psychology is, the first and foremost is body image problems. This body image is not the problem of today or yesterday. It is over years and years, and very commonly when it comes among women, women want to be thin, slender, and beautiful, whereas man wants to be strong, meaty, and handsome. So this, if the boy is thin and slender, he's been criticized and he has a greater mental impact. So boys always want to build their muscles, whereas girls want always to be thin and slender. What happens with this body image? They quite commonly fall prey for the wrong or misinformative problems, which is called as fad diets. This affects the body dysmorphic, and what happens with the fat diets is, commonly this fat diets, for example, you must have all come across the paleo diet, keto diet, all these kind of diets. Actually, not all of them are wrong. They have been designed for medical nutrition therapy actually. For example, keto diet is designed for a epileptic child which has higher protein or higher fat content but low in carbohydrate. When a person who is obese start taking this, he may reduce weight immediately or within 3 months because of less carbohydrate. His body will start utilizing the stored in carbohydrate. But after 3 months, what happens is the weight will not reduce and they will already get a dysmorphic problems. They will already get into the eating behavior problems. This is the very important psychological problem we come across more than the health problems. They get addicted to certain kind of habits, so they may turn anorexic nervosa or bulimia, which I don't think I need to define all these things, and binge eating. And most commonly, I come across people with pica eating too, and rumination. Rumination, I don't think not everybody will be knowing, so I just think I should give a detailed definition. Rumination is nothing but they will eat all the food, but after or certain period of time, maybe after some 3-4 hours, they can mm, belch the food and make it regurgitate and bring it back to the mouth, and they will again chew it, again try to swallow or spit it out. This is very common post infancy. That is, once the weaning starts, the children with gastric problems may start getting this, or the children with autistic spectrum, or the children with ADHD. These people commonly get this kind of rumination, and if this is not stopping at the early ages, this is a problematic problem condition which needs the opinion from speech therapist or occupational therapist. But at the same time, this rumination happens also in the adolescent when they fall prey for fat diets also. And avoidant or restrictive food, this also again most of you must not be come across. Avoidant or restrictive food intake in the sense, we might have been coming across some of the teenagers who will not particularly eat their breakfast or lunch, but night they will complete feasty diet they will follow, like biryani or alfam or the wholesome meaty substances they will follow on the night times. This is also one of the condition people fall prey for. The very important problem we come across is obesity, which is a vicious cycle with the mental dysfunction like cognitive impairment, schizophrenia, depression, and eating disorder, and also reward abnormality. So, why the diet is important and how it works on their mental health? The diet is commonly with 5 major food groups: micronutrients, macronutrients. When the macronutrients, especially macronutrients, are reduced in the fat diets or in the problems with overeating, like stress eating and other problems, macronutrients is compensated with one or other, or they will eat one particular nutrient but they will miss some other nutrient. For example, a person who wants to reduce weight, they will skip eating carbohydrate, or they will just keep eating overeating proteins. If a person is depressed, or the person is into a continuous stress, they will continuously eat fatty foods, but they will not eat carbohydrate or protein. So this particular, what happens is, if the micronutrients is not balanced, that if they are not getting adequate carbohydrates, the brain function chemicals like serotonin and tryptophan is not properly triggered, which is going to impact on the brain, and it will affect the mood, and it also declines the cognitive function. And when it comes to protein, the brain is one of the major area is filled with or made of amino acids. This amino acids or the neurotransmitters, or it is a synthesis of neurotransmitters to aggravate or increase our mood functions. Again, fat is very important because fat is the highest level in our brain. Brain lipids is mostly 50% composed of fatty acids. So what happens if these three is compensated or avoided? the energy what the person is supposed to get. For example, when the carbohydrate is reduced, the person is lacking cognitive skills. Whereas when the fat is reduced or fat is not taken or healthy fat is not taken, they have a sluggishness. They could not think properly. Clarity of thoughts will not be there. And when the amino acids are not properly taken, again, their creativity will be reduced and intellectual habits will be reduced. So these are the some of the neurotransmitters which are affecting our body. It will deteriorate our memory skills, and some may even bring you. You must have come across delirium, the delirium, or we cannot think properly or think with the clarity. This is the common problem. And when the serotonin is reduced, the mood is low, and they feel sleeplessness or feeling disconnected, feeling alone. There is no joy in any work. They feel like totally they are hopeless. So how this dopamine is totally dopamine will drive out of motivation and enthusiasm, and it is also stimulating cravings. Okay. And GABA will make us like cannot switch off and always irritable, agitated mood, anxiety, and all those things. For such problems, the foods to avoid are sugar, deep fried junk food, alcohol. Nothing but this junk food has to be kept away, and they should eat the wide range of micro and macronutrients. So here, when it comes to micronutrients, we commonly think that micronutrients are very important, that is sufficient for life, but micronutrients are very, very important for brain functions and psychological problems. When there is a psychological problem, very commonly in children with poor concentration attention, we come across vitamin B1, B6, B12, and vitamin D deficiency. And in depression, we come across vitamin B3, and in poor memory, vitamin B5. And vitamin C and D are the responsible factors for depression. And irritability, insomnia, and confused mindset is basically because of minerals, lack of eating minerals. So these things has to be concentrated for good mental health. And what should be avoided is always nothing but high fat, high sugar, high salt, HFSS. This is nothing but all our junk foods classically comes under this HFSS. What happens with this HFSS habits is when a person like starts with the morning hours, they will not eat anything. They will just go fasting. They will just skip their breakfast and go for 10 o'clock. They will go for having some tea with some bakery or confectionaries. And again, they will not have hungry because they already have a full high fat, salt, and sugar confectionaries. So they will not skip again their lunch. Evening, again, some kind of the junks with the coffee or tea beverages. And dinner, it will become a very heavy hunger, and they will go for lot of fried items like full whole chicken or full whole fish. The fish or chicken, which is animal source of protein, when fried, it turns become a high fat content, not any amount of protein required by the body. So what happens with this kind of continuous junking habits is their concentration, attention, more than anything, their mood is totally changed. They are always agitated, they were always irritable, and they couldn't trust anyone. They are always in the group social, but they couldn't behave well, and they could not be calm and context. They will become slowly, they will turn into greedy, and which will lead into depression. So this is the quite greatest concern for our next generation, and in the future challenge we are going to face. So, in my particular clinic, what are the poor nutrition concerns I had is the very common is procrastination in women. So I come across lot of women who continuously say, "Ma'am, I want to do lot of many things. I want to like a super women. I want to remodel my life, career, and my home. I want to make everything perfect, but I couldn't do. I always think that okay, after 10 minutes, and this 10 minutes is never ending. So when I check this particular group of women, I always find them they lack vitamin D or iron or folate deficiency. And the most common cause of fear and anxiety I come across is folate and vitamin A deficiency. When the vitamin A is less, people are like really shaking or anxious, like uh, even a person with the thyroid, low thyroid, they will also have the same kind of fear and hormonal dysfunctions. They will also have this fear and anxiety problem. Whenever the emotional ensues, they couldn't control their mood, or they just burst out in tears, or they burst out with the shoutings, yellings. This is commonly this is low carbohydrate. They start eating very low carbohydrate, or they start skipping their meals, especially in children. They want to preparing for competitive exam, they want to go to school on time, they just have 10-15 minutes time. What they think is okay, let me move my food away. But what happens, this food habit slowly diminishes their memory, attention, and also it slowly put their emotional state very badly, and they keep bursting at everyone. They get always, they are fearful, they are agitated with everyone, and they cannot trust anyone. And the same thing with stress, we come across iron and iodine deficiency, and poor life skills, or again iron, vitamin D and A. And panic attacks is very common with vitamin K deficiency and very low carb diet. And depression, vitamin D, suicidal thoughts also, vitamin D is responsible, and iron, iodine deficiencies. In dementia, most commonly early dementia, I come to see that very low protein diet and mineral deficiencies and cognitive decline in both children and adults. It is mainly because of vitamin and mineral deficiencies. So now let's get back to the case. What happened with this boy after analysis? What we found is this boy is continuously with his grandparents. There is a large generational difference, as I earlier mentioned. This boy was always pampered by his grandmother with after every scolding, the grandfather will feel sorry for that. And while he'll come back with the pack of junk foods like mixtures or cakes or pastries. He come back with that samosas and pani puris. So this grandmother also in home, she will overfeed him with food. And this child with any problem or any happiness is always fed with food. And this what happens, his eating behavior is totally ruptured, and he continuously eat for everything. He continuously keep on uh, munching food, and he will be binging. And mainly because of his uh, body shape and size, he couldn't concentrate in his subject, because over fat, high fat slowly diminishes the child's concentration ability, and this child could not focus on what is taught in the school. So what happens is his grades are getting reduced, and people started mocking him for his poor academic skills as well as his obesity. So what happens? He wants to compensate his inferiority complex. He slowly starts developing the superior qualities, what he thinks it is right, but they are not actually right. What he do is he starts bullying others. He start verbally abusing others or stealing others' lunch boxes, like as a way he could punish them for their teasing. This kind of problems arises with his high fat, high sugar, and low nutritious foods and poor food discipline. His food habits are very indisciplined. He can even eat at midnight. So these are the things which we found very bad. And what we thought is the child must immediately lose weight, because the abdominal width is nothing but the visceral fat. So this has to be reduced. We started giving him yoga practices, and for his overcoming his personality disputes and personality problems, we gave him art therapy sessions also. Along with that, he was, as a first line of intervention, he was given a healthy eating habits. He was given a dietary advice, and with that, he was also strictly put on exercises like walking, swimming, cycling, like all those things. So after 3 months, he started showing differences with the proper eating habits. He could recollect things. His memory was little better with proper eating habits. With the 6 months, he could be focused or sit and able to attend a particular class for 40 minutes or at least for 2 consecutive sessions. So, this is what the first cognitive change we could see in his behavior and self esteem. It took a longer period, like 6 months, he took for improving his self esteem. After his first periodic test, he was finding better. He could able to sit for the whole 3 hours and try to recall things. But in the second periodic test, he improved much better and he could even pass the exams. That was the first thing which improved his self-esteem. Then slowly this boy could able to much better and improve with all this set of cognitive behavior counselings. And this was nearly around 14, 15 years back. So today he is doing his master's in dentistry and he is also a health educator. So, what is the continuous nutritional psychology gives you a message as today's take home is not all psychological problems are due to poor nutrition, but in most cases, we are coming across that giving a proper dietary pattern or right eating habits improves their not only their physical health but also mental health. And while treating neurological functional problems like autistic spectrum or ADHD or even learning disability or even smaller behavioral issues, please just check into their nutritional habits or dietary intervention, and that will be the must be the first line of treatment. And remember, food should not be an emotion or addiction. Food must be an discipline. Thank you. Now it's time for your questions.
Thank you. Yeah, thank you, Sripriya ma'am, for that wonderful, comprehensive session on, nutritional psychology. We just have a little time for interacting. And dear participants, if you have any questions, you can either unmute and interact with the speaker. You can just go ahead with your questions. Ma'am, the participants have requested you, if it's possible for you to share the PPT, you could do that.
Definitely, ma'am, I can share you the PPT.
Thank you. Thank you so much. Participants, if you have any questions, you can interact with our speaker.
Good evening, ma'am.
Yes, ma'am. Yes, sir.
Sorry, okay, ma'am, Anita, ma'am, she may proceed first. I think she asked some questions. Let me wait. No problem.
I think I can give her a... Yes, sir. You can go ahead. Please, sir.
Okay, ma'am. Okay, yeah. Good evening, ma'am. It was a wonderful session, and you explained everything in detail. It covered every areas regarding nutrition and malnutrition and many things. So my question. I have one question regarding especially for small kids, small children. I have one kid, 2 years old. So how to improve their immunity, because that's a big problem, big concern for the small kids. So what kind of immunity building foods you can suggest for small kids?
Sir, again, this is a wonderful question for nutritional psychology aspect. Today, everybody asks us what are the foods to develop immunity. But one thing I'll tell you, the food cannot be feeded in children like medicine. You should eat such foods so that the children will follow. And commonly, the immunity boosters are nothing but fruits and vegetables. You can follow the red, yellow, orange, or now they call it rainbow colors of fruits and vegetables. And in this rainbow colors, we also insist on wholesome grains. That is, like for past few generation, we were like for the reason of quick cooking or for the color or taste or texture, we have been using this white rice, maida, and polished items. But what is wrong in this polished foods is all the fibers and sodium, potassium, minerals are lost. So try to go incorporate the wholesome grains and our traditional millets. These are all immune boosters. And always keep one green leafy vegetable. A green leafy vegetable is the best source of all the nutrients. It is a power of house of nutrients. So one green leafy vegetable a day is like I can say that an apple a day can be rephrased to a green leafy vegetable a day can keep you away from a doctor.
Okay, ma'am. Thank you so much. Thank you.
Thank you. Thank you, sir. Thank you, ma'am. Neelam, ma'am, do you have any questions? Neelam, ma'am?
You're in mute, ma'am.
You're mute, ma'am. Ma'am, you have to unmute. Neelam, ma'am? Ma'am, kindly unmute
Your
Neelam,
audio.
ma'am.
Oh, that was a problem with me. And the ma'am, it was so wonderful session that I have liked so many things about children and how, no doubt about that, children sometimes make fuss while eating things. And if a mother is aware of all these things, that is the irony of the situation. Mothers also sometimes pamper their children by giving junk food and all that. And sometimes they're also tempted to. Frankly speaking, sometimes I think most of us who are sitting, this is modern times and we go along with children, that happens. But most of the time, our generation has been looking after children, most of the educated women, I can say, and ideas which are given, they are beautiful ideas. And I don't think anything is lagging behind or anything has been left by you. It was such a wonderful session, ma'am. I just thank you so much. Thanks a lot. Beautiful session.
I'm really honored to get such feedback from a senior person like you, ma'am. I'm very happy, and
Thank you, ma'am.
it's really very happy feedback.
Very nice.
Thank you.
And the group which is holding all such webinars, that also doing a great, we can say, service to society, service to the children of the present times. Hats off to them also. To you, all appreciation, and whatever they appreciate, that is less, because you are given such a wonderful thing.
Thank you so much.
All of us.
Thank you so
To
much.
all of us. Thank you, ma'am. Thank you.
Thank you. Any more questions, participants? You can just go ahead with your question. Dear participants, if you have any questions, you can raise your hand and go ahead. Yes, sir. Yes, sir. Saroj, sir.
Hello, ma'am.
Yes.
Thank you for the wonderful session. It was very informative.
Thank
And gut being the second brain was knowledge I liked really. Because if we don't have good food and if it is disturbing us, then our moods and emotional life can be very disturbed. What I would like to ask you is how to handle if someone has eating disorder, of the sense like there is no discipline at all, like they feel like eating anytime and every time, and thereby no order is there in the person, and that leads to further mood fluctuations now and then because there is lack of discipline. So how to deal with inorderly or disorderly eating habit?
Basically, this disordered eating habits is one kind of depressive, or majorly it is because of their dysmorphic functions. Okay, so we always say that D for depression, discipline for depression. So this discipline is not only ruptured in their daily routine like bathing or anything, it is also ruptured in their eating habits. For this kind of eating disorders, what I do is I first give them the education or awareness about the nutrients, and I'll also take their biochemical parameters. Being a nutritionist, I can take the biochemical parameters and show them this what are all is less and why do you feel so. So this, when we give the proper kind of supplements in the sense, most commonly, unless it is highly deficient, I don't prescribe any supplement, and I don't write supplements on my own. I'll send them to the general practitioner and I'll get them written the supplements only by the general practitioner. So once they start taking the supplements, they will start having the change. They will feel the betterment themselves. So with this, our cognitive behavior therapy is the beautiful way we can tell them how to. And some, no, as you asked in this eating behavior, some are like, especially in the binge eating case, no, they will be very particular. I want this. I cannot be without this chocolate, or I cannot overcome this eating of sweets or halwas. This particular time, what I do them is thought breaking process, like using the rubber band technique or diversion. Art, therapeutic art, we can tell them that while you want to do this, you just make this halwa into some pieces, keep it into the small pieces and keep it away from you. Don't eat a whole chocolate in a minute. You can cut this chocolate into small pieces and keep the tray there, and make a whole drawing or do a small pieces of some craft. And then after this, if you really want, you can touch. But what happens with this art, no, they will completely involved in this art, and after this they will feel light and their stress is reduced, so they will not go back to that comforting food. So this is some of the techniques I use. Giving supplements is very important, but not by us. We don't prescribe supplements, only with the general practitioners or their physicians.
Thank you, ma'am. Thank you.
Thank you, madam.
Wonderful, ma'am. Positive intervention, how we can apply in our counseling session. You beautifully explained. I think no other doubts. Anita, ma'am, please go ahead for VOT, ma'am.
Thank you, ma'am. Ma'am, kindly accept our gratitude on behalf of the Deccan Positive Mental Health group members, which has Manasa Shubhakara Mind Care Hyderabad, Yellow Point Counseling Center Hyderabad, Forest Creative Arts Studio Punjab. And thank you so much for a wonderful session. And dear participants, thank you for your wonderful interaction, and have a wonderful weekend. And thank you so much once again, ma'am. Thank you. Thank you, everyone.
Thank you, Anita, ma'am.
Thank you, ma'am.
Yeah.
Thank you, Sripriya. Thank you, Needhamji.
Thank you, ma'am. Good night.
Good night, participants.
Good night, everybody.
Good night.
Good night.